Hello,
Hi.
my name is Sachin. I'm one of the nurse practitioners today, and I'll be examining you today. Is that okay?
Yes.
Okay. May I have your name, please?
My name is Reena Singh.
Rina Singh. And how old are you, Rina?
I'm 39 years old.
You're 39. And what is your date of birth?
0208-1980.
0208-1980. Okay. Is it okay if I can call you Rina, or would you prefer Mrs. Singh?
Reena is fine.
Rina. Okay.
hmm
So Rina, what is bringing you in today?
I came here for my annual exam.
Annual exam.
Mhm.
When is the last time you had an annual exam?
I had last year around same time.
Same time.
Same time this month.
Oh, okay. And then you have annual exam every year, pretty much, or?
Yes.
Okay. Well, that's a good thing.
hmm
So do you have any specific complaints that's bringing you in, or just
No.
annual checkup? Just annual checkup.
Just an
Okay.
channel
All right.
checkup.
Okay, Rena. Do you take any medications at home?
I do take Tylenol.
You take Tylenol.
hmm
How many milligrams of Tylenol do you take a day?
I take 2 tablets, about 650.
So you take 650 milligrams per day, or is it how often do you take it?
Well, I take regularly, kind of like every other day or.
Okay, so you take about 650 milligrams every other day.
mhm.
Okay. What do you take the Tylenol for?
I get backache. That's why I take the medication just for my pain, to
Oh.
relieve my pain from my backache.
Oh, okay. So you have a lower back ache pain,
Yes.
and then you take Tylenol for that pain.
Mhm.
Okay, and you take 650 milligrams. You say you take it every other day.
Yes.
So do you, for the 24-hour period, you take 650 milligrams per
yeah,
day?
just
So two tablets?
just once a day.
Just
Try not
once a
to-
day. Okay.
Yeah.
About what time do you take the medicine?
During my evening time, before like after coming back from my work.
So you take it at the evening time after coming back from work.
Mhm.
Okay. What do you do for work?
I'm a nurse.
Oh,
I'm
okay.
an LVN.
Oh, okay. So is there something that you do at work that kind of makes the pain worse, or?
Yeah, maybe sometimes by lifting patients, I don't know, maybe I do it wrong way, or maybe standing on my feet for a long time.
I see.
So that makes my pain go up, or makes me uncomfortable.
Well, I hope you have help at work to
Yeah, I
help you
do.
move.
I do, but maybe it's not enough help.
I see. I
Mhm.
see. Okay. And how long have you had this pain in the back pain?
It's been few years now. It's been happening from last 4-5 years, I can say.
So about 4 or 5 years.
Mhm.
About 4 or 5 years. Okay. Did the pain came on all of a sudden, or was it one day you just woke up with pain, or was it kind of gradual pain and got worse with time?
Yeah, it's getting worse with time, you can say. I had that problem, but after having my kids, but I noticed that it's been getting more often now from last few years.
Okay. Is it interfering with your life at all, or is it?
No, not yet, but seems like it's been having a regular issue.
Okay. Is it Tylenol does help your pain?
Yes.
Are you having the back pain right now?
No, I'm okay right now.
Okay. So the Tylenol does help your pain.
Yes, it does.
Have you ever followed up with your physician in regards to this pain and requesting for further workup, or?
Yes, I did.
Okay. So what happened?
The doctor said if it's get really worse, like if I can get up or anything, then they're gonna think about doing something like X-ray or something.
So they haven't done any kind of imaging on your back pain at all?
No,
Okay.
not yet.
So he or she's maybe under the impression that it's a musculoskeletal pain?
Yeah,
Okay.
maybe they said it's just like general pain of by not having a good position or.
Oh, I see.
Yeah.
Okay. Does this pain, when it comes on, does this pain radiate anywhere else, or it just kind of localized to your back area?
Just a lower back pain.
Okay. Okay.
Yeah.
And it doesn't radiate to your down your legs or
No,
in
no.
your abdomen.
No.
Okay. Do you have any other associated symptoms like nausea, vomiting, or sweating for no reason with this pain, or
No,
anything like that?
Nothing.
Okay. Is there something that you do that makes the pain worse? For example, if you were to twist a certain way, or move a certain way, would you say the pain will get worse with movement?
Maybe standing too much on my feet, or sitting for long period, that could also bring my back pain back. So
Okay.
by sitting,
Okay.
like I noticed, like with sitting or standing long time.
Okay, and your back pain gets worse with
Worse,
time.
yes.
Okay. How would you describe this pain? Is it a dull pain? Is it a sharp pain? Is it cramping? Is it throbbing?
It's just maybe throbbing, you can say.
Just throbbing pain.
Mm-hmm.
Okay. And you take Tylenol for that, and
Yes.
the Tylenol does help.
Yeah, it does
Okay.
help.
And your primary care physician already knows about it, and they're
Yes.
planning to do imaging, and
Mm-hmm.
if the pain gets worse.
Right.
Okay. And this pain started about, you'd say, 4 to 5 years ago.
Yes.
And how often do you take the Tylenol? You said you take 650 milligrams every other day.
Yeah.
But you say you take it about how often? 3 to 4 times a week, or?
Yeah, you could say that. It depends on how my pain goes along.
Okay.
Then I feel like having it, then I take it to
Okay.
get relief.
Okay. Do you take any other medications at all
No,
besides
just
the Tylenol?
just a regular vitamins.
Okay. Is it prescribed vitamins or over-the-counter vitamins?
No, just over the counter.
Okay. Do you know the name of the vitamins?
I think vitamin D, vitamin C, just the
So
regular.
D and C, just over-the-counter vitamin C and vitamin.
Mhm.
How often do you take that?
Try to take every day. If not, then once or twice a week.
So once or twice a week. Are you
Mhm.
supposed to be taking once or twice a week, or is it every day dosing?
The doctor prescribed me to take vitamin D.
So it
but-
is a prescription med. Or
well, just over the counter.
also verbally told you to
Just verbally,
just take the over-the-counter
the
vitamin D.
Vitamin D.
Okay.
But I just take when I remember.
Oh, just when you remember.
Mhm.
Okay. And how long have you been taking the vitamin D?
Just in a year.
About 1 year.
Mhm.
Okay. Did you have any blood work about vitamin D at all that suggests that you may be low, or is it just?
Yeah, I had my labs done last year, so it showed that it's been a little low, so that's why my doctor prescribed me to take vitamin D.
Do you remember
over the
how low
counter.
it was? I'm sorry.
No, I don't remember the value.
Okay. Have you repeated the blood work since then?
No, I have to go back,
Okay.
but I haven't gone back yet.
Okay. So vitamin D and vitamin C.
Mm-hmm.
Okay. Do you take any other medications besides the Tylenol and vitamin D and vitamin C?
No,
Okay. Are you allergic to any medications?
no,
Are you allergic to any food?
no,
Are you allergic to any environmental, seasonal allergies?
no,
Okay. Are you allergic to any animals or pets or anything like that?
no,
Do you drink alcohol at
no,
all? Do you smoke cigarettes?
no,
Do you use any kind of illicit drug use?
no.
Okay. So, do you take any other alternative medicine?
No.
Past medical history. Do you have any significant medical history as in childhood?
No.
Okay. Have you ever been treated for any kind of a psychiatric disorder?
No.
Been admitted in the hospital for any reason?
No.
Now you did mention you have two children.
Yes.
Okay. And how old are your kids?
My older one is 12 and my younger one is 7.
And 7 years old. Okay.
Mm-hmm.
Were they born here?
Yes.
Okay. And how were they delivered?
I had a C-section for both of them.
So you had cesarean for both of them.
Yes.
Were there any complications with the cesarean?
I was
No,
fine.
okay.
Mhm.
Did they attempt to do a vaginal delivery
Yes.
and then kind of proceeded?
Yes. They tried to induce me for my normal delivery, but they noticed that my older ones started having discomfort, so they decided to do a C-section.
Oh, okay, so the older child started having some complications, and then
Complications,
decided to proceed with the
Yeah.
cesarean.
Right.
Okay. And you said there were no complications
No.
with the cesarean on both the child.
Both the childs, yes.
And any other surgery history at all? you been admitted to the hospital for any kind of medical reasons?
No.
And never been diagnosed with any kind of medical conditions as in childhood?
No.
Okay. How do you maintain your health, Rena? Do you exercise regularly? Do you eat healthy food?
Yeah, I try to eat healthy myself, my vegetables and fruits, and try to work out when I get the chance.
Oh, okay.
Yeah, I'm not regular in working out, but whenever I get time, I go out. And
What kind of exercise activity
I
do
go
you do?
for walking. Walking is my main thing.
Okay. How often
Yes.
do you walk?
Maybe
Let's say in a week, how often do you walk? How often?
just
do you-
once.
So you go
when
about
I-
once a week.
Yeah.
Okay. And how do you pace yourself? I mean, do you use a watch to see how fast you go, or
No,
is there certain minutes that you walk for?
maybe 40 minutes.
So about 30-40 minutes once a
yeah,
week.
once a week.
Okay. Besides walking, do you do any kind of aerobic exercises at all?
No.
Okay. And as far as eating healthy, how do you do that?
I try to add more vegetables and fruits in my diet,
Okay.
and try not to eat unhealthy food. That's how I maintain my health.
Okay.
Yes.
Are you able to provide me an example with what's unhealthy for you?
Like eating more sugar food, or soda. I try to avoid all those.
I see.
things.
I see. Okay. You all your immunizations are up to date?
Yes.
Okay. As childhood, I'm sure
Mm-hmm.
you're a nurse, so I'm sure for your work as a requirement, they would probably require you to be up to date on your hepatitis B,
Right.
MMR vaccine,
Mm-hmm.
and all these other medications. Your Tdap. Did you get your flu vaccine last year?
Yes, I did.
Okay. Do you get it every year?
Yes, from the time I'm working, it's the requirement, so
I see. Okay.
I get it.
When was your last skin test for the TB?
I think when I did it I think I did last year.
Oh, you
at
did it
my
last
work.
year?
Yes.
Okay.
Mhm.
And what was the reading of that?
It was negative.
Negative. Okay.
Yes.
Okay. Any immunizations? So you're 39 years old, Rena.
Mm-hmm.
Did you had a pap smear done?
Yes, I did.
Okay. When was the pap smear done?
It's been done last 3 years ago.
Okay.
Yeah, it's due again, but I get it done last 3 years.
So it's due this year?
This year.
When is it due?
It's due in next month, in June.
Oh, okay. And did you already make an appointment?
Not yet.
So are you going to call your primary care doctor,
Mhm,
make an
yes.
appointment? Well, that's kind of important to do, Rena,
Okay.
to prevent any kind of, I'm sure you already know as a nurse,
Mm-hmm.
prevent any kind of progression or finding of a cervical cancer.
Okay.
So in June, you said, and you
Yes.
will call and make an appointment and get that done.
Right.
Okay, good. Tell me about your family history. Do you have any siblings?
Yes, I do. I have a brother and a sister.
You have a brother and sister. How old is your brother?
He's 28.
28. And where does he currently reside?
He lives in India with my mom.
Oh, okay. And how is he doing? How is his overall health?
He's good.
Does he have any
Yeah.
medical problems that you know
No.
of? Does he take any medication that you know of?
As far as I know, no.
Okay. Do you have any other sibling?
Yes, I have a sister.
And how old is she?
She's 35.
She's 35. Does she
Mhm.
have any medical problems that you know
No.
of? No. Okay. And does she take any medications for any reason?
No.
Okay. And your parents? Your father?
My father is no more. He died a long time ago.
Your father passed away a long time
Mhm.
ago. I'm sorry to hear that, Rena. I know it must be really hard to get over that, losing a close loved one like that. May I ask, how did that happen?
He had a car accident.
Oh, he had a car accident. And what time? When was this? What year was this?
Probably in 1991.
1991.
Yeah.
Okay. Do you know if your father had any medical problems at all?
No,
So did you take any medications for anything?
as far as I was very young, but I don't think so.
Okay. And your mother?
Yeah, my mom has asthma and she has high blood pressure.
So your mom has asthma and she has high blood pressure.
Mhm.
How old is your mom?
She's 60.
She's 60 years old.
Mm-hmm.
Okay. I'm sorry, how old was your father when he passed away, do you think?
Well, he was very young. He was 33.
33.
Yes.
Back to your mom.
Mhm.
So asthma history, what does she take for asthma?
She lives in India, but as far as I know, that she takes albuterol and a nebulizer. By the name of the medications, I'm not sure. But
Okay.
she's in there, so I don't know. But as far as I know, she takes albuterol and nebulizer.
She takes the albuterol inhaler?
Inhaler,
and,
yes.
and the
And
nebulizer?
nebulizer,
Okay.
yes.
How often do you think
She takes every day. Once, I think twice a day, in the morning and in the evening.
both the inhaler and nebulizer, or just a nebulizer?
I think the nebulizer.
Okay.
Mhm.
And the inhaler is
It's, I think, when needed.
only when
When
needed.
needed,
Okay.
yes.
Does she take any other inhalers or medication for her asthma?
No, I don't
Okay.
know. I'm not sure.
When was she diagnosed with asthma?
I think it's been few years now. I'm not sure exactly what time, but yeah, it's been few years, like 4 to 5, maybe more.
Okay.
Yeah.
And
I think she was maybe 40, 47 years old.
47. Okay.
Yeah, it's been a long time now. Yeah.
Does she smoke cigarettes?
No,
Has she ever smoked?
No.
Okay. And when was she diagnosed with high blood pressure?
I think around same time.
So 47 years
Yeah.
old approximately. Okay.
Mhm.
Does she take any medication for high blood pressure?
Yes, she does, but I'm not sure about what the name of the medication is. But I know she takes every day.
Every day.
Yes,
Does she take one medication, two
One.
medication?
once a
One
day in the
medication.
morning.
And is that helping with her blood pressure? Or?
Yes.
Okay.
Mhm.
Does she have any other medical problems, asthma and hypertension?
No.
No. Okay. All right. And she currently lives in India?
Yes, she does.
Okay. Tell me about your maternal grandfather.
I was very young. I'm not sure what was the problem, but he died a long time ago. I was in kindergarten.
How did he pass away? Was it as a result of a medical
He had a
condition?
medical issue, but I'm not sure what was exactly. But I remember he was in the hospital when he died.
Okay. And how old do you think he might have been when he passed away?
Maybe around 50.
Oh, around 50.
Yeah.
But you're not able to recall
No.
what reason he was passed. How about your maternal grandmother?
Is she still alive?
Oh, she's still alive.
Yeah.
Oh, that's good.
Yeah.
How old is she right now?
Almost 85.
85. Wow.
Yeah.
And do you know if she has any medical problems that you know?
No, I'm not sure.
Oh, really? For 85? Okay. She takes any medications at home?
I don't know. I never asked.
Oh, you never asked?
No.
Okay. But she's still alive, and,
She's
and
still-
she's doing good, I'm
Yeah,
assuming.
she is, yeah.
How about your your paternal, so from your father's side, grandfather, your paternal grandfather.
My grandfather died, I think in 1994 or 6. I'm not sure exactly which year, but he had an ulcer and he went to the hospital because after that he never came back.
So he had a
Ulcer which
in the-
I think it burst in his stomach and then he started vomiting blood and then he got admitted in the hospital and he never made back.
Oh, okay.
Yeah.
Well, sorry to hear that, Rina. So had an ulcer in the stomach, burst, and then started bleeding, and then
Bleeding out of the
once he
mouth.
went to the hospital, he unfortunately he never came back.
Mhm.
Okay. How old was he? Do you think when
He
that?
was 74.
74 years old.
Mhm.
Okay. Do you know if he had any medical problems at all
No.
besides the fact that he had an ulcer? Do you remember him taking any medications
No.
growing up? No. Okay.
Mhm.
How about your paternal grandmother?
Yeah, she also died around the same time. After 6 months, my grandfather died. she got also hospitalized. She got pneumonia.
Oh, she died from pneumonia.
Yeah, and then she never made it back either.
How old was she when she passed away?
I think maybe same age, probably 73, 74.
Okay.
Not know exactly, but
So your paternal grandfather passed away, and then 6 months later you said
Yeah.
your paternal grandmother. I know that must be really hard for your
Yeah.
family. I'm sorry to hear that, Rena. Okay. All right. So have you visited your mom recently, or?
yeah, I'm planning to go this year.
Oh, okay. Well, that's gonna be fun.
Yeah, it is.
When is the last time you met your mom?
3 years ago.
Oh, 3 years ago. Okay, I'm sure she must be really excited.
Yeah, she is.
All right, Rena. I'm gonna just go over here with your personal history, if you don't mind. Okay. So you told me you're a nurse. How where did you obtain your education from?
I went to Xavier College in Stockton, here.
Oh, Xavier
Yeah.
College here in Stockton, California.
Yes.
Okay. How long have you been practicing as a nurse?
3 years now.
Okay. Are you a registered nurse, or are you?
No, I'm an LVN.
Oh, you're LVN licensed,
Mhm.
vocational nurse. Okay. Are you planning to study further for your RN?
Yes, I
Okay.
do.
All right. Okay. Okay. And you are originally from India.
Yes, I am.
Okay. Did you also study in India as well?
Yes, I did.
Okay. What did you study in India?
Oh, I had a bachelor's in accounting.
Oh, yeah, bachelor's in accounting.
Mm-hmm.
All right. Do you practice any other alternative health practices?
No,
Do you use any kind of alternative medicine? Anything that is prevalent in your culture or community
No.
at all? No? Okay. All right. And do you, how do you spend your leisure time?
just to watch TV or
Watch.
just do my meditation.
Oh, you do meditation?
Yes.
Okay. What type of meditation is this, if you don't mind me asking?
I do Indian yoga, like a pranayam.
So you do Indian yoga like a breathing exercises?
Breathing exercises.
How often do you do that?
I try to do every day.
You try to do every day.
Yeah.
Okay. Is it a yoga that involves moving and posture, or is it more
No, it's more like on your concentration on your more breathing.
breathing? Okay.
Yes.
Okay. All right. So I'm just gonna go over your general system by system complaints. How much do you weigh right now?
I think I weigh about around 130.
About 130 pounds.
Yes.
Have you lost any significant weight, unintentional weight loss?
No.
Okay. All right. Do you have any generalized pain, besides the fact that you have lower back pain, which has been going on for, you said, about 4 to 5 years?
Mm.
Any other generalized weakness or
No.
fatigue or anything like that? No?
Nothing.
Okay. All right. Any problems with your skin?
No.
Any rashes or any problems with your hair, your nails,
No.
or any dryness in your skin at all?
No.
No. Okay.
Mhm.
Do you use sunscreen?
Yes, I do.
Okay. How often do you use a sunscreen?
I use once in the morning.
Once in the morning, and is it every day when you?
Yeah. As the weather is summer, so I try to do it every day.
Okay. Just any problems in your scalp region?
No.
No. Okay. All right. I see you're wearing glasses. Is that prescription glasses?
Yes.
Okay. When did you get these prescription glasses?
I was very young when I started wearing my glasses.
Oh, okay. But how about this specific?
Oh,
glasses?
this one I got it like I think I went for my eye checkup last year.
Last year.
Yeah,
Okay.
that's
So and
right.
then you got new.
Got my new
Prescription.
prescription.
Do you
yes.
remember the number of the prescription glasses?
I think my right eye is 4.25 and my left is 6.25 something.
Of the glasses itself?
Glasses itself.
Okay. Is it? Do you remember if it's a positive or negative?
I'm not sure it's positive or negative, but.
So 4.25
and
and
6.50.
okay. On your right eye is 4.25, left
Yes.
eye 6.50.
Yes.
Do you have any kind of stigmatism?
No.
No. Okay. Okay. Does your parents wear glasses too? Or?
My dad used to, I remember, but not my mom.
Okay.
She just started wearing now her reading glasses.
Okay.
So otherwise.
Do you have any headaches at all? No.
Oh no.
Okay. Do you have any vision changes recently
No.
at all? Okay. All right. Any problems with your eyelids,
No.
or do you have any dryness of the eyes or excess
No.
tearing? No.
Mm-mm.
Okay. Any problem with the eyelids at all?
No.
No. Okay. Any problems with your ears? Do you have any earache, any ear pain? Are you able to hear from both the ears?
Yes.
Okay. Do you clean your ears often?
Yes.
How do you clean it?
By using earbud.
Oh, okay.
Mm.
Okay. All right. Any problems with your nose or sinuses?
No.
Okay. Do you have any seasonal allergies? No.
No.
Okay. Any problems with your throat?
No.
No. Any problems with your teeth or tongue?
No.
No. Okay. All right. Okay, we're gonna go down to your neck. Have you experienced any kind of swelling in your neck at all, or do you have any neck pain?
No.
Never had any neck pain? Okay. Have you checked your thyroid?
Yes, I did.
Okay. Was it normal or?
Yeah. Well, when my lab work was done last year, my primary doctor mentioned me that my TSH level was a little higher, but my other hormone level was okay. But my primary doctor said they're gonna monitor by doing lab work every year and to see like how my TSH level and other hormone level is gonna be, and according to that they're gonna go. But I haven't been diagnosed anything like hypo or hyperthyroid, anything.
Okay.
It's just my TSH level is little higher than my normal value ranges.
Okay, and this test was done last year?
Last year.
Last year. About what time?
I think somewhere around in April or March I have to go back again to do my lab work again, but it's been last year.
So is he checking every yearly?
Yes.
Okay, so just to make sure that I'm understanding what you're saying, so you had a TSH level down which showed that it was elevated,
Yes.
but your thyroid hormones well at a normal level.
Mm-hmm.
So he did not prescribe you any medications
No,
for it.
no.
All he's doing is monitoring it every year just to make sure that there's no significant differences in your thyroid. Okay.
Right. Yes.
Do you feel cold at all at certain times, or hot, or anything like that, or do you feel more hungry than usual, or
No,
loss of
it's
appetite?
just I feel cold as I don't know. This is my problem. Like I feel cold even though weather is not that. I don't know. It's just like me. I always feel cold.
You always feel cold?
Yeah.
Okay.
Yeah. That's how it is.
Okay.
But
Is that something that led to him checking the TSH
yeah,
level?
I mentioned my doctor why I always feel cold even though the weather is not that cool, but I still feel that I always feel cold, so that's why he decided to order
I see,
some
the
lab work
TSH
to-
level.
Yes.
Okay, Reena. And otherwise no other neck
No,
pain,
no other-
neck pain in the back
No,
area.
no.
Never had any injury or
No.
trauma to your neck.
Mhm.
Okay. Any problems with your breasts at all?
No,
Okay. Any pain or any discharge from the nipple?
no.
Do you self-examine your breast
Yes.
How often do you do that?
Whenever I remember.
Whenever you
So,
remember. Okay.
Yeah.
That may be important.
Yes.
Um, because self-examination is what you can, women can feel if they are having any lumps or anything like that, that they can present it to their primary care physician for further evaluation.
Right.
So that's something that's really important to do, Rena. Okay.
Okay.
Okay. Any problems with your lungs? Are you coughing at all?
No.
Do you use any inhaler, or do you have any shortness of breath?
No.
Any pain with breathing?
No.
Do you smoke cigarettes?
No.
No. Okay. Are you exposed to secondhand smoke at all?
No.
No. Okay. And you mentioned you're not coughing at all or anything
No.
like that. Okay. Any problems with your heart that you know of?
No.
Do you have high blood pressure, or ever been told you had a murmur?
No.
And do you have any chest pain?
No.
Do you ever had an EKG done on your heart?
No.
Okay. And are you experiencing any kind of ankle swelling or leg swelling at all?
No.
Okay. And do you take any medications for your heart?
No.
Any problems with your stomach or your esophagus, or how are your bowel patterns?
It's good.
Do you go bowel movement every day?
Yes.
Okay. And is it pretty formed? How often do you go? Is it once a day, twice a day? Okay. In the morning when you wake up, you go once a day. Okay. No problems with the bowel patterns or
No.
the consistency of the bowel movement itself. How would you describe that?
It's normal. It's not. It's foam.
It's formed.
Yeah.
Okay, it's normal. Okay. Any problems with your liver?
No.
Okay. Never had any surgery in your stomach or in your abdomen? Have you ever had an endoscopy or colonoscopy done?
No.
Okay. Do you have heartburns at all?
Mm-mm.
No?
No.
Okay. Any problems with cramping of your legs?
No.
Or leg pain? Ever been told you had a blood clot in your legs at all?
No.
No. Okay. Any problems with your urinary system? So when you go pee, does it burn at all?
No.
Or does it hurt? Okay. Any foul smelling odor from your urine?
No.
No. Are you experiencing any any flank pain, because the kidneys are located at the back?
No.
Any flank pain? I know you did mention you have lower back pain, which it seems like it sounds musculoskeletal, because your primary care physician has recommended an imaging, X-ray imaging, if the pain gets worse. So the impression is that it may be musculoskeletal. Regardless, in addition to that, are you experiencing any kind of flank pain, meaning that if for you it feels different, the pain in the back at all?
No.
No. Okay. Rena, I'm going to ask you some personal questions. Are you married, single?
I'm married.
You're married, and how long have you been married?
15 years.
15 years. Have you ever been treated for sexually transmitted diseases?
No.
Never. Okay. How young were you when the period started?
I was, I think, 11 or 12 years old.
11 or 12 years old. Okay. Do you have periods every month?
Yes.
Okay. What is the duration of that?
4 to 5 days.
4 to 5 days. And how would you describe as the amount? Is it a
It's
lot?
normal.
Normal for you?
Yeah.
Do you have a lot of pain when that comes on?
No.
Okay. Are you using any kind of contraceptives to prevent pregnancy
No.
at all? Okay. Do you use any kind of sexual protection when you? Are you sexually active?
Yes.
Okay. Do you use any kind of sexual protection
No.
at all?
It's my husband.
Okay. What does your husband use?
Condom.
Oh, okay. Okay. So you have 2 kids. Are you planning to have
No.
any more kids? No.
Mm-mm.
Okay. All right. Do you have any joint pain and stiffness or any kind of pain in your wrist or joints or anything like
No.
that? Okay. I know I already asked you about your back pain.
Back pain.
You said as of right now, currently as we're speaking, you're not having any kind of back pain.
No, I'm fine right now.
Okay. All right. Have you experienced any significant weight loss?
No.
No. Have you ever been treated for any kind of psychiatric disorder, anxiety,
No.
or any kind of mood disorder, anything like that? Okay. Do you have any headache at all, or vertigo symptoms, dizziness, or anything like
no,
that?
nothing.
No. Okay. Any numbness or tingling of your extremities at all?
No.
No. Okay. Have you ever been diagnosed with any kind of blood disorder?
No.
Low blood count or anything like that?
No.
Ever had a blood transfusion?
No.
Okay. Do you experience easy bruising at all anywhere,
No.
anything like that? Okay. And you don't have diabetes, do you?
No.
Okay. Any other endocrine problems have you been diagnosed with? I know you told me about the thyroid level. They're monitoring that also, but nothing else you've been diagnosed
No.
with. Okay. All right, Rena. Well, thank you very much for your time,
Thank
and
you so
it was a
much.
pleasure interviewing you. And you're welcome here anytime you like for your physical exam. Okay.
Okay. Thank
All
you.
right. Thank you. Have a good day.
Thank you.